Hi, everybody. I'm Tony Caridi, and I hope this finds you doing well. I wanted to share something with you that came from our community leaders launch of the United Way campaign last week. Our keynote speaker was Dr. Clay Marsh. Who better than to talk about COVID-19 and how we as West Virginians are battling against the virus? He made several comments that pertain to you and I and how we can be safer in our everyday life, how we need to be safer as school gets ready to begin, and also when it comes to athletics. So, on behalf of the United Way, we wanted to share these comments with you. Hopefully, they will help you battle COVID 19. Here's Dr. Clay Marsh.
Well, I have to say, what an amazing group of people who are zooming in today. Somebody said the most dangerous event is a general with a microphone. Well, it may be a doctor with a stage here. So what I'd like to do in the next maybe 15 minutes or so is kind of review where we are in West Virginia with COVID-19, where we are in our country and our world. What are the treatments and the ways that we can protect ourselves? And then I end up and talk about school openings, and then of course Mountaineer football, which I think is near and dear to everybody on the stage. I see Tony Caridi right there. So this pandemic, as David Hardesty said, is really a once in a lifetime event, and I think most of us, including me, really underestimated the impact and the breadth and the depth of this problem. And let's just review really briefly what's happened in our world. You know, in our world, we're approaching 20 million cases, and we've passed 500,000 deaths. In our country, it took 99 days to get our first million cases. It took 43 days to get our second million cases. It took 28 days to get our third million cases. It only took 15 more days to get our fourth million cases, and we're real close to getting to our fifth million case. And you can tell how this has increased and decreased in time, increased in the rapidity of spread. And this is really the big issue with this virus. There's really three reasons why this virus is really quite challenging for us. So number one, there's something called a reproductive number. We've called it R naught or RT. And basically what that means is it means if a single person's infected, how many other people are they likely to infect? And if you look at the influenza, the rate of infection of a single person infected is about 1.2 to 1.5 new people. Now, if you look at the measles, which is an incredibly infectious process, the one person infected will infect 12 to 15 people. In COVID-19, one person infected infects 2 to 2.5 people. Now you might say, that doesn't seem like that much, 2.5 people, you know, that seems kind of slow. Let me do a little math for you, just to demonstrate why this sort of 99 days, 43 days, 28 days, 15 days, why this really matters. Okay, single person infected with COVID, he or she infects 2.5 new people, they infect 2.5 new people, et cetera. Let's use 2, which is on the lower side because I can do the math better. So in 10 doubling times, 6 days doubling time, in 2 months, 60 days, that one person infected will have infected 1,024 new people. Now, the number 31 person in South Korea infected 3,000 people. A person in Hong Kong infected 300 people. A infected person in a choir practice at Washington State infected 52, infected 46 and 52 people in that choir practice. And these people are called super spreaders. Okay, so in 2 months, that one person infects 1,024 people. Excuse me, go 2 more months, 10 more doubling times. That one person, if you haven't interrupted that one person will have infected 1 million people. That's with an M. And if you go 2 more months, that's 6 months, and you haven't interrupted this cycle, that one person will have infected 1 billion people. That's with a B. So this logarithmic compounding effect, that's what we call the surge. And when we first started, we were worried about how fast person-to-person contact would go and how many people would be infected at once, because what happens is that increases the number of people infected to the level that it creates a big surge of activity generally around your healthcare enterprises. And that's one reason, like with David Goldberg here, we are so worried about flattening the curve, which basically just means we're trying to slow down that logarithmic rate of progression. And what's interesting about that is that we know today that, let me go, so that was number one problem. The number two problem is we know today that the most infectious time for somebody to spread the infection is in the 2.5 days before symptoms to the first day of symptoms. So many, many people don't know they have COVID, don't know they can spread COVID, and they do. And so it's been estimated that about 50 to 75% of all COVID spread is spread by people who don't know they have it. Now, there are people that are asymptomatic, meaning they have no symptoms, and those people actually can spread as well. But the feeling today is more of the people that spread are in the pre-symptomatic phase, or right before they develop symptoms. So that's the second reason why this is so problematic. The third reason why this is so problematic is because this disease is highly efficient in spreading, and it spreads by droplets and spreads by aerosols. So merely talking can suspend droplets and aerosols in the air, and if you have COVID, in the laboratory for over an hour. And if you're singing, or if you're yelling, or if you're panting, or if you're around people closely, you can spread this person to person either via the mouth, the nose, or the eyes. So all three of those have been demonstrated to be modes of spread. And because we are used to being close to each other and around each other, that is really a problem. And you don't have to be coughing or sneezing or sick feeling to be able to spread it. So that is really the reason why we have been so committed to masks and physical distancing. And they basically work in combination. And today, the disease is widespread enough. Deborah Birx came on TV over the weekend and said it's really widespread. And I'll go over that in just a second. But it is widespread enough that you should follow the Japanese. They have the 3 C's that they talk about. So you should avoid crowds. You should avoid closed indoor environments. So if you're going to socialize or eat dinner or something, outside better than inside. And you want to avoid close, constant contact with somebody you don't live with. So 15 minutes or more, 3.2 feet or less. We say 6, but it's really 1 meter is the data that makes you have a higher risk of getting COVID if you're around somebody. But this is important to know. So if you look at data from China, and you look at people who have COVID who live in the same house with family members, you might guess the spread is really, really high. Well, it turns out only about 14% of the family members get COVID from somebody who's infected. And if you look at the same address, then about 17%. So it's not like everybody gets COVID, and that's the reason why we don't want people to freak out about it, but we do want people to be careful. And let's just talk about mask wearing just for a second, because this got to be pretty controversial, although I think it's better today than it was. So let's just go through a little bit of data, and many people already know this, and I'm kind of like, I have a few stories, so it's kind of broken record time, but for you guys who haven't heard this, I think it's important to know. So let's look at 2 mask wearing countries, and I'll pick Hong Kong and Japan, and let's look at 2 lesser mask wearing countries. I'll pick the United States and Sweden, and I'll talk about why in a minute. So let's compare Japan to the United States. Japan has 127 million people, United States 330 million. So Japan's about a third of the population of the United States. If you look at Japan, Japan had gone through other really serious respiratory infections like SARS and MERS and others. So they wore masks. They're a mask wearing culture. So if you look at the US today, as I said, we passed 4 million cases pretty recently, and we're on our way to 5 million. And Japan has like 8,000 or 10,000 or some really small number. The key though is we have over 150,000 deaths. They have 1,000. They have 1,000. So on a proportional basis, you have a less than 2% chance of dying in Japan on a population adjusted basis than you do in the US. So to me, that's a piece of evidence to suggest mask wearing does make a difference. The second two countries I want to talk about is Sweden versus Hong Kong. Now, Sweden's a country of 10 million people, Hong Kong 7.5 million. The area, the square mile area that Hong Kong's in is much smaller than Sweden. So on a density basis of square mile, Hong Kong's much more densely populated than Sweden is. Sweden is probably the illustrative country that said that we're going to go for what's called herd immunity, which basically means we're going to let our population get infected with COVID-19 and slowly try to get immune response to that, which you need about 60–70% immune response to COVID to be able to protect your population. And we hope that's what the vaccine will do for us eventually. But Sweden decided they had a healthy population. They were going to protect their elderly because about 50% of all the deaths that have occurred from COVID-19 have been in nursing home populations, congregate setting, older people. So those are areas you really want to be careful about. But anyway, they've kind of trusted their population. And today in Sweden, they have 5,700 people that have died of COVID, which is 5 to 20 times more than any other Scandinavian country. And Hong Kong has had 44. So I think that when you look at this, and there was a paper that came out that said countries and states that went early mask wearing have a 100-fold reduction in deaths from COVID. And the National Governors Association demonstrated that if you're a state, and this has been a bit ago, but if you're a state that doesn't have a mask wearing law order, or if it's only focused on employees and businesses, you on average saw a 70%, that's employees and businesses, to an 84% increase in the number of COVID cases that you saw. If you had a mask law that basically said patrons, customers, employees needed to wear masks inside, you saw a 12% reduction. And if you had a mask law that said everybody's got to wear masks everywhere, you had about a 25% reduction in COVID cases. So I think that this idea about wearing masks is important. Now you might say, okay, well, why is it important? And I mentioned it before, but I'll just be very clear. The reason why it's important is because masks, when worn properly, and this is a disposable one, so you want to make sure when you put it on, this is clean, you put it over your nose and your mouth, put the ear loops around your ears, pull it down. So if it doesn't cover your nose and it doesn't cover your mouth, it doesn't work. And when you take it off, don't take it off this way and don't play with it. COVID could be here. Take it off that way. And these are disposable masks. Once you take this guy off, throw it away. You have to wear it again. Put it down on this side and pick it up by the ear loops and fit it on your face again. But don't touch the mask again once you've taken it off, whether it's cloth or it's disposable. But the idea is masks reduce the amount of droplets and aerosols that you generate. And that's why outside's better, because outside disperses these droplets and aerosols. But ultimately, you're wearing a mask. It protects you a little bit, but you're really wearing a mask more to protect other people from you than you are to protect you from other people. And that's the reason why having more people wear masks, the modeling is 80%, but we know that countries that are 95% or so mask wearing are really countries that have, as I talked about, Japan and Hong Kong, have a very, very marked beneficial effect in reducing COVID spread and reducing the death rate from COVID. The other thing that's important is that physical distancing, and the real data is 3.2 feet, and for every 3.2 feet away you are from somebody else, you gain a 2.2 times advantage of reducing your risk of getting COVID. So, and that benefit is with a mask or without a mask. Masks make it better. So masks plus physical distancing is today what all the experts are believing is the most effective reduction, COVID reducing approach that you can do. So let's talk just for a second about treatment. And many people are real excited about vaccines, and there's several kind of really accelerated vaccines going on today. The fastest vaccine ever made was polio, and you guys may not be able to guess, but that was done at the speed of light, and it took 4 years. from beginning of the vaccine to get it distributed. So the fact that we are talking about having vaccines ready at the end of this year and maybe distributed in 2021 is unbelievably fast, crazy fast. Most of the vaccines use a different technology, which basically puts the genetic material of the COVID virus in a way that basically they inject it and your body starts to make the part of the virus and then responds against it. There's other vaccines that don't. So this will be the first this kind of virus to be done at this rate of speed. So that's the reason why some people are kind of like, well, let's be a little careful here. We want to get it to be done quickly. We also want to make sure that we do it effectively. And when we look at other treatments, there is a new sort of approach, which is going to be an antibody cocktail. That's what's used for Ebola virus, which is a deadly virus in Africa that people have heard of. And the idea is you basically are modeling the types of immune responses from people who have had COVID, and now you're creating those in an engineered way so that you can produce a lot of antibodies. So it's a treatment that you can give people, and the feeling is that will likely be helpful. It may not be curative, but will be helpful. And remember, HIV, which was at one time kind of like COVID-19, maybe not quite as much worldwide, but we were so worried about that. And that's really been controlled by medication. You know, we don't have a vaccine for HIV. And so I think the medication plus the vaccine will be really important. Hydroxychloroquine, which is a drug that the president has been very excited about, there is some data if you look at people's experience with that. But when you start to go to really, clinical trials are done really, really well. 3 of them say that hydroxychloroquine with or without azithromycin, which is the Z-Pak drug, doesn't really benefit people with COVID-19. So I think that right now is an on-the-shelf drug for me at least. But there's some other drugs. There's an antiviral agent called remdesivir that seems to help people who have critical illness. There's a drug called dexamethasone, which is an old drug. It's a corticosteroid, super powerful anti-inflammatory that seems to be really beneficial for people, particularly in the ICU. And then there's taking blood from people and giving plasma from immune people to non-immune people that seems to work. And then there's some maneuvers in the ICU that can help, where you put people over on their stomach to help reduce or to help draw the blood to areas of the lungs that are working better. And then there's a treatment called ECMO, which is extracorporeal membrane oxygenation, which is basically a bedside cardiac bypass machine that has also been demonstrated in very critically ill people to benefit them from a mortality standpoint. We certainly have all those treatments here. When you start to look at schools, and you start to look at mountaineer football and sports, the couple of things I think are really relevant. So number one is the amount of disease, the amount of COVID you have in your community is probably the best predictor of what's going to be able to make it and what's not going to be able to make it. So we really want to push the amount of COVID down again, and anything over 3% on a daily or a rolling average weekly basis is too much. So Mon County had a big spike that was 75% 18 to 29-year-olds. And by the way, if you look at Florida, in April, the average age of a COVID positive person was 65. Today, it's 35. In West Virginia, we have twice as many people in the 18 to 29-year-old group than anybody else. And Mon County was really driven by young people. And in Ohio, it's in the 30 and 40-year-old group. So COVID is infecting people that are younger and younger. If you have too many cases at once and you get, as I was talking about, this surging where you get too many people spreading to too many people, it's really impossible to be able to keep track of that. And what you want to do is you want to take the people that are, I know I'm almost up here, the people that are infected and separate them from other people. And that's called contact tracing, where you basically review all the contacts. And you want to take these super spreaders, these people that can infect a lot of other people, which is about 10 to 20% of folks with COVID, away from other folks. So we want to get the disease activity in a community down. And that's really important for school. That's really important for sports. That's really important for everything. And then as we go forward, there's a lot of conflicting data, but I think the best data would say that young kids, 0 to 9, 0 to 10, spread less well and get infected less well than older kids. That people who are middle school and high school can spread like adults, maybe not quite as well, all of them, but generally like adults. That masks are going to be part of our school experience in class, and we're going to have a lot of distancing. We're going to have cohorting. So basically, the kids stay around the same kids all the time. You're sitting in the same seats, because if somebody gets sick here, then you haven't infected the whole school. You infected this little pod, and that's what you're going to move with. We're going to have, I know the governor just committed to online plus in class. And one of the reasons why we're being really careful is not only because we don't want COVID to spread, to get the healthcare, overwhelm the healthcare workers, but more and more we understand that COVID is not absolutely benign for the people that get sick. So we know that the mortality rate, it's been at least speculated by modeling that the mortality rate of COVID-19 is probably somewhere between 0.65 and 1%. Influenza is 0.05 or 0.1%. But across the country now, we have about a 3% mortality rate, and worldwide about 4% of all the people that have been identified. But we also know that about a third of the people with COVID at 3 weeks who are outpatients will not feel right, won't feel back to their old self, and about a fifth of the people 18 to 35 years old won't feel well enough to go back to work at 3 weeks. And there's a study from Germany that basically said an average of 71 days after COVID, and this was an age of about 50 years old, 49 years old, with a third of these 100 people been treated as an outpatient, 2/3 outpatient, 1/3 inpatient, that 80% of them had heart abnormalities from COVID on screening. And 63% of these people had active inflammation on their heart. Again, this was 2.5 months after their COVID. And so we're now starting to look at COVID positive people, particularly younger people, to try to understand what are the complications. And the ones that are really concerning are blood clotting, so acute strokes and acute heart attacks, even in people with no pre-existing problems. Neurologic problems, so problems with fuzziness, with memory, problems with paralysis. That's something that can be seen. And then heart problems, and I described those. So I think as we go, I kind of look at COVID like, I don't know if you've ever seen the poster with the iceberg and the little bit of the icebergs above the water and the massive amount of the icebergs below the water. I think we're starting to understand that COVID is not just something that we want to protect ourselves from because it could kill you. And the narrative is, oh, if you're younger, don't worry about it, you're fine. It's really a risk to the older people. But now we're understanding that COVID is a disease that it affects many organs because it gets in the blood vessels because of the receptor it binds to. And we know that because it can circulate everywhere, that the long-term effects of COVID in certain people might be quite problematic. And so, we may be looking at a whole generation of people who have different kinds of chronic illness as manifestations of COVID, even if they survive the acute illness. So that's the reason why we really have to get word out. And I really appreciate, and I'll stop after this, people on this Zoom call. One, because you support our community, and that is so important. Thank you. But two, because we need to get this message out, and we need to get this message out to our kids. Deborah Birx talked about super spreader events, which are basically events where people are socializing, they're close, they're not wearing masks, they're not paying attention. And the thing is, everybody has a right to do what they want to do, and I would never stand in the way. But for me, from a medical standpoint, and from being a father, and and understanding this disease more, this disease is even perhaps worse than I thought it was, because of the potential for the morbidity, not just mortality, dying, but the morbidity, the side effects, and the chronicity that I am very, very worried that we will see from this. So anyway, that's my upbeat message. Sorry for the in being a little bit maudlin, but thank you guys for all you're doing. David and Susan, thank you for your leadership. You guys are awesome and love you both. And Brandy, thank you for what you're doing and your team, and for everybody on the phone call that includes so many friends and people that I love and care about. And I love it that in West Virginia, I will say the last thing, Thomas Friedman, New York Times editorial writer, said that the difference in outcomes in our country are not the rich versus the poor or the coast versus the middle. It is the strong communities versus the weak communities. And I believe we have very strong community. And I thank you for that.